The latest health targets have been published for the Southern District Health Board. Richard Bunton is the board's Director of Patient Services and he joins us to explain the results. Good evening, Richard.
Good evening.
What do the results say about the SDHB?
I think the results about the SDHB say that in terms of delivering quality health care, the SDHB is right up there. The health targets were targets developed by the previous Minister of Health, and he picked on the key issues he thought were important. We are monitored, each one has a national champion, and you see the quarterly reports come out, and so we're quite driven by that. But I think the bottom line for us is it shows that the quality of care is good. What
improvements have been made?
The improvements over the time, we used to have our ED target, for example, was an issue. It was around the mid-80s, where it's supposed to be 95%. Now it touches on 95%. We've made real headway in our diabetes and heart checks. Used to be 40%, now that's up to 80%. Our immunisation rates have always been right up near the top. Our elective surgery rates are 100%. And so we do, compared to other DHBs, we do really quite well.
Yet we've heard that we are lagging behind for the diabetes and heart checks.
Well, we are. We haven't got the target yet, but we did start at 40%, and so to go to 80%, I think, is good. And that's just within the last little while, so that's good.
And we're also struggling to help smokers quit.
Yes, those figures are a little bit misleading. Some of the targets just relate to the hospital, and some of the targets relate to the whole DHB. The target for the hospital runs at 95%. The target for the whole DHB runs at 76%, which means primary care runs at about 50%.
Does the board need to do better?
We always try to do better. I mean, that's what the whole thing about quality initiatives is about, to sort of point out the areas where you should be able to do better and sort of strive to do better.
How can you do better?
I think just by being more vigilant, remaining focused, and that's what the health targets team to do. I mean, they're a relatively blunt instrument in terms of measuring the quality of health care, but it certainly reminds you that the eyes are upon you, and I think the public's expectations we should develop, service good health care, and we do that.
Are those targets achievable?
Well, we have achieved most of them, and yes, they are achievable. A little bit work, 1 or 2 more percentage points on ED and a bit on the heart and diabetes checks, but otherwise we do achieve those targets.
How do we compare to other DHBs?
We compare quite well. Like everything else, we do better than some and not quite so well than others in terms of the target that you're looking at. But if you would look at the targets for Canterbury Health and for Capital Coast South, we're pretty much on a par.
Are there incentives for reaching targets?
There's incentives for not reaching targets, because someone from the ministry will come down and tell you how bad you are and you need to improve.
How close is the board to reaching all of its targets?
Pretty close. As I said, there's a couple of areas that we need to do some work on, but there's some of the other targets we do well reached, basically.
What is the benefit of having these results published quarterly?
I think it hopefully gives the public confidence in that. There's so much about the SDHB in the newspaper and media nowadays. It's not quite so positive in terms about living within our means, but I think in terms of clinical care and health delivery, I think it should give the public confidence.
SDHB Director of Patient Services, Richard Bunton, thank you so much for your time.